Hello everyone, this is Dr. Wood. I'm excited to welcome you back to your third clinical course. This is Fall NSC 800 2020. We will review the syllabus. This is a 4-hour credit course. Always, if you need to get in touch with me, my contact information is there at the top. List of facilitators with their corresponding emails. To be in this course, you have successfully completed pathophysiology, pharmacology, physical assessment, your first and second FNP lecture courses, NSC 870 and NSC 872, and also your first two clinical courses, your first two 800 courses in the spring and summer, and then you have a corresponding lecture course with this clinical course. The corresponding lecture course is NSC 874. You all know your clinical textbook is the 5-minute clinical consult. Your textbook, online version, or both, and then any textbooks that you purchased for your previous FNP lecture courses. Corresponding lecture course for this fall, NSC 874. Technology information and EKU bookstore information has not changed from prior courses. Student learning outcomes are the same for each 800, and we will continue to work on those student learning outcomes. And as you all can see, they align well with our case simulation assignments and SOAP notes. All right, so satisfactory completion of the following would be site visit, and there may be more than one site visit depending on your clinical schedule. This does not include peds or women's health. This will include any primary care site or urgent treatment center site that you have. So if you have more than one primary site, or you have a primary site and you've got some urgent treatment hours that you're making up from the spring or summer, then you'll sign up for 2 site visits, one for each site and preceptor. Satisfactory on all clinical forms. The first reflective writing is due by the end of the first week, so we'll make note of that on your calendar. And then we're going to start out with an interactive group case simulation with an acute and chronic case to learn from each other and refamiliarize ourselves with that process so that we're prepared for the 2 individual case simulations. You will do a SOAP note write-up on the interactive sim and both the individuals. So there's a total of 3 SOAP notes, and a satisfactory evaluation from your preceptor at midterm and upon completion of your hours and completing 150 hours of direct patient care. And those of you who have any remaining hours due to the suspension of clinicals in the spring, any hours remaining from spring or that you couldn't obtain for summer need to be caught up in addition to the 150 hours. If you're caught up, you will only complete the 150 hours. But if you have any remaining hours from spring or summer because you couldn't finish up where we suspended in the spring, or you weren't able to get the entire 150 for summer, now is the time to catch up on those hours before moving into that final spring practicum. Evaluation form looks the same, however the criteria there, the bar has been raised. So as always, you're going to be in the top column for interpersonal communication and professionalism, and then for the remaining categories, you're going to be in the top 2 columns. Form that we're going to use at midterm and upon completion of hours. And also the form that you use at the end of your specialty rotations in peds or women's health. This is the self-eval form also, which does not require a preceptor signature. The self-evaluation does not. So students will achieve a satisfactory on all assignments to be successful in the course. If you've received an unsatisfactory on something that would constitute unsuccessful in the course, you would be administratively withdrawn from the MSN FNP concentration, but could elect to remain in the MSN core courses and complete some of those. For any type of readmission to the FNP program, please refer to the Graduate Student Nursing Handbook readmission application process and forms. Reminder that late assignments without prior approval from the faculty of record would not be accepted. It's professional behavior and expected that all assignments are completed and submitted on time to Blackboard. Assignments are not to be emailed directly to myself or to facilitators. All assignments are placed inside the Blackboard course. So the fall course begins on Monday, August 17th and runs for 16 weeks. We're 1 week shorter this semester due to planning for COVID, and it finishes on Friday, December the 4th. Students may attend clinic all the way through to the very last day, Friday, December the 4th. However, do keep in mind where your final NSC 874 exam falls, and make sure that between your work and clinic that you have sufficient study time if you're going to extend all the way to the end of the semester on clinical hours. Students are expected to be in professional attire with your white lab coat and wear their EKU identification badge in clinic at all times, unless the clinic prefers that the student not wear a white lab coat. Students are expected to arrive to clinic on time and complete the entire clinic day as previously scheduled with your preceptor. Frequent changes to that clinical schedule are strongly discouraged. We are guests in the clinic, and preceptors are gracious enough to share their time and clinical expertise, so we do not want to take advantage of them. We want to be on time and be there when we say that we're going to be there and finish out the day. If there's any changes that are just unavoidable due to certain circumstances, immediately communicate that with the preceptor and with your faculty, your facilitator, and or myself. But frequent and unplanned changes to the clinical schedule is considered unprofessional behavior, and professional behavior would constitute unsuccessful clinical performance and unsuccessful in the course. We're preparing you for primary care practice, and that is being at a site that provides health promotion, disease prevention, and treats acute and chronic conditions across the lifespan. Preceptors, of course, can be nurse practitioners, but can also be MDs, DOs, and PAs. Would not be permitted. Students may not be in clinical with relatives, close friends, or at one's own place of employment. Now, having said that, we do realize that there's larger institutions with multiple clinic sites, and that's okay. You could utilize a site under a larger umbrella organization. Utilize a site that is separate from your workplace. In any event that a clinical preceptor or clinical site is not providing an appropriate clinical experience, and the student is not progressing, please reach out to me. We want to know. We want you all to get the most out of each one of your clinical rotations. If we deem that the site is not providing an appropriate experience, the student will relocate. That will be a requirement in order to successfully meet the objectives in the course. This being your all's third clinical rotation, some of this is reminders that the only time that can count toward clinical hours are direct patient care. So therefore, any type of breaks in the clinic day or lunchtime or time putting in type-on entries, that does not count toward direct patient care. If there's no-shows or large gaps in the preceptor's clinic, and you're not involved with patient care, that time would not count toward direct patient care. However, any time that you spend surrounding a patient visit can count, is appropriate to account. So for instance, anytime you're looking up information in the chart or looking at your resources before you go into the room, obviously any time spent talking to your preceptor about the patient, time in the room, time charting on the patient in the electronic medical record. Time involved with that patient encounter can count toward that direct patient care time. Clinical days, your time should start within the first couple of weeks of the course and continue throughout. We want you involved in clinic We have decreased that to help out to a minimum of at least 10 out of the 16 weeks, but we want you to be in clinic so that you can apply the information that you're obtaining in the corresponding lecture course. So any changes to that minimum of 10 weeks would need to be pre-approved through me. So if you have any questions about that, don't hesitate to contact me. You can go to clinic any day of the week, up to 12 hours a day. But again, remember the minimum 10 week and make sure that you are, it doesn't have to be consecutive, but that you're in clinic a minimum of 10 out of the 16-week semester. Make sure that you have enrolled for personal liability insurance. We're due to renew. It's always from August to August, so you must have registered for that this August as well. We're very familiar with the SOAP note templates at this point. Make sure you're using the acute SOAP note template, the chronic one, or the acute and chronic in clinic, just depending on what's appropriate for that particular patient encounter. Specialty hours are not required, but certainly encouraged. If you're not receiving the appropriate amount of peds visits, you want to make sure that you're getting acute peds, well child visits of all different ages. If not, consider a peds rotation. It's going to be important that you get those in so you can look at immunizations at different ages, anticipatory guidance, and those developmental milestones. If you're not receiving sufficient women's health visits, in your primary care site, then also consider a women's health rotation. You'll be covering women's health content in your corresponding lecture course the second half of fall. And you can also do specialty sites in your final spring practicum. So kind of keep that in mind as you're looking at planning your clinical schedule. You may receive up to 80 hours in pediatrics and 40 hours in women's health. In order to head off to the clinical setting, students must complete the telehealth checklist prior to going to clinic. That is submitted to Ms. Christy Isaacs for approval, and then you also hang on to that form and you upload it to your Blackboard course when the course opens, and that'll also be checked by your facilitator, but that must be approved prior to attending clinic. There's also a new form this semester. I want to bring that to your attention. It's a clinical placement waiver that must also be completed and submitted to the Blackboard course and approved by your facilitator prior to going to the clinical setting. Always, you must communicate with your facilitator prior to starting clinic and exchange that information with them, the name of your site and your preceptor's name and credentials and the phone number to the clinic and your cell phone number. Find out the best way to reach your facilitator. Let them know how many hours that you have or you plan to complete and any remaining hours that you would be making up from the spring or summer this semester. So any specialty site information for peds or women's health. If you have more than one site, you want to provide all that information and make sure they're very clear on what you're doing. The telehealth checklist and the clinical placement waiver, again, must be uploaded to Blackboard before you can start your clinical rotation and exchange information with your facilitator. The clinical schedule form is due by the end of your very first clinic day. In your clinical schedule form, there just needs to be one form, regardless of whether you have specialty sites or more than one primary care site or a primary care site and urgent treatment center, whatever it is you're doing. Just have one schedule form and denote the different sites in different color text so that it's very clear and all together on one form what it is you're planning to do as far as clinicals this fall. Otherwise, that could be too many clinical schedule forms to keep up with, obviously, and have a good understanding of what it is you're doing. So one clinical schedule form with all the information on it for all sites denoted in different colored text. So it's easy to see what site you're at on which day and also the times that you plan to be there on that day. Checking out that clinical schedule, I would add some extra days due to any potential illness, inclement weather, anything that may be unforeseen with you or the preceptor or the site. And then you can eliminate those days as you continue to reach your either 150 or whatever your total hours are that you're trying to obtain if you have any remaining spring or fall hours. You can start eliminating days. But as you do that, keep in mind the minimum of that minimum 10-week requirement. Know that this clinical schedule form must remain up to date at all times. So if there's any changes in the schedule, you will revise and resubmit to Blackboard. And immediately communicate those changes, of course, get those pre-approved by your preceptor and also your facilitator and or myself, the course leader. Preceptor receipt, acknowledgement of that they received the preceptor packet and welcome letter, and the preceptor vita is due by the end of your second clinic week. You take that daily clinical verification log with you each day in clinic, and there's one for every month. So it's not a rolling log, it's a log for each month, and you submit that to Blackboard at the end of every month. And this is your preceptor initialing and signing, and you signing and dating that the information on that form is correct. So that must exactly match what's on your clinical schedule form and what is entered into the Typhon system. Now, I do realize that, the clinical schedule form is about the time frame that you're going to be there. If you put on your clinical schedule form that you expected to be in clinic today from 8 to 5, but clinic ran over and you stayed until 6, then there's no need to make any revisions on that clinical schedule form. But if you weren't in clinic at all today due to whatever reason, then yes, you would revise that and mark out that day, and maybe you would need to add a day or maybe not, depending on how many makeup days or extra days you had on your schedule. So I understand that the times may not be exactly right. If you tend to run over, that would not need any corrections, but the days need to be correct. Midterm clinical evaluation form due Friday by midnight at the end of week 8 is October the 9th. Final student clinical evaluation forms are all due the Tuesday of the last week of the course, and that's on December the 1st, and that's due by noon to allow facilitators time to check forms. We've talked about site visits. You all are familiar with a site visit. That's a site visit for any urgent treatment center or primary care site that you may have, not for peds or women's health. So you may be signing up for more than one slot. If you do, please indicate the provider or the name of the agency or something so that I can denote, which site visit is with which location or provider. If your phone number or your preferred method of communication has changed, please note that on the doodle poll as well. Sign up for a site visit, if at all possible, by the end of week 2, so we can start getting those site visits on the schedule. The poll will remain open for the remainder of the semester to accommodate any late clinical starts, but we want to try to have all site visits completed by midterm. Important to make sure that the day you sign up works for your preceptor, so communicate with your preceptor on the best date and time that would work for them for a site visit. And keep in mind that the doodle poll is in Eastern Standard Time, so you need to adjust your thought process for Eastern Standard Time if you're in a different time zone. No big changes with Typhon entries. I know you guys are very familiar with Typhon. The thing we implemented over the summer, which we will certainly continue moving forward, is the new addition of the patient interaction to denote whether it was an in-person visit, a case simulation, or telemedicine visit. As you all know, over the summer, we started counting more hours toward case simulations, and case simulations are entered into the Typhon system, and you choose Eastern Kentucky University and you choose my name as the preceptor and enter it like a normal patient encounter and mark that it was a sim. And you all know that you can count the time spent on the Zoom session, which takes about 2.5 hours with our new debriefing session at the end of our sims, and then you can count an hour for prep time because you're uploading your preparation notes on the template, and you can count an hour for the write-up. So sims are about 4 to 4.5 hours for each sim, and you know that there's going to be 3 of those this summer, 1 group and 2 individual. That'll kind of help you plan your clinical schedule out as well, because case simulation hours do count toward the direct patient care time. So you want to try to deduct for that and plan for that. All patients seen in the clinical setting are entered into the Typhon system, and students will list all diagnoses that were addressed during that particular patient encounter. Beginning of this rotation, just make sure you change those default settings in Typhon. Make sure you're under the fall course. Now, we reduce the hours, but in Typhon, it's still going to say FNP3. This is your third clinical course, right? But it's going to say 200 hours. So pick the one that says fall semester, and then the course is the one that's FNP3 for 200 hours. But you all know we've reduced that to 150. So just make sure you're entering your Typhon entries in under the correct course and semester so that you don't have to go back and redo any of those. An entire week to get Typhon entries in. So if you're seeing patients in clinic this week, those entries are due by next Friday, as you all know. So you have a full week to get entries in. Exception to that, of course, is going to be the last week of the course. If you're attending clinic any day that last week, Typhon entries are due by midnight of your final clinical, the end of your clinic day of your final clinical day that week. Start out, we're going to have one group interactive Zoom case simulation this semester, and that is scheduled with your facilitator. There will be, each facilitator will schedule 2 groups in week 3. If something doesn't line up with your schedule, please communicate with your facilitator and we can see if we can get you in another facilitator's group. So if we've got 8 facilitators and each of them are scheduling 2 sessions, we've got about 16 groups to choose from. It is ideal to stay with your facilitator if possible, but if it's just not possible with your schedule, please reach out and we will see what works for you. It's the student's responsibility to sign up for any type of Zoom session. Failure to sign up or no-show certainly would result in an unsatisfactory score on that assignment. From the summer, you guys on those evals, surveys, really enjoyed the group work. So I hope you're going to enjoy getting together to begin with and learning from each other and the facilitator as we do that first acute and chronic case together as a group. And of course, we also need to be able to evaluate you independently as well. And then we'll have 2 individual sims this summer, but the process for all of them are the same. Your ticket to come to the simulation is that you have prepared, and you will prepare by watching the pre-briefing video for the simulation and then using the acute and chronic SOAP note template to write up your questions, any notes that you may have for each section on that template, and submit that to the appropriate link on Blackboard at least one day prior to your scheduled simulation. So facilitators check that you have viewed the pre-briefing video and that your SOAP note with preparation notes are uploaded. With any assignment, always take a look at the grading rubric to know what the expectations are. So for the group interactive Zoom case simulation, it's preparation and participation. 2 individual case simulations this semester, and we will follow the same format in the individual case simulations as we do in the group interactive case simulation. There's a different rubric for the individual case simulation. So again, take a look at the rubric as you're preparing so that you know what the expectations are for this particular assignment. As mentioned earlier, all simulations will be an acute and chronic patient encounter. And with the individual case simulations, note on the rubric, be prepared to do a verbal presentation to your facilitator, just as if you came out of the patient room and you were presenting the case to your preceptor in the clinical setting. Be able to clearly support your diagnosis or diagnoses with the symptoms and signs and any information that you found out about the chronic disease, and be able to refute all other differentials. Important reminders about the requirements for group and individual simulations. This is just as if we were coming to the clinical setting and observing you with a patient encounter. So we expect professional dress with your white lab coat and your EKU name tag during the entire simulation. Must stay visible on the screen at all times. Sign on early to make sure if you have any technical issues, you've worked that out in advance. Have your phone with you, but on silence in case there are any technical problems. Have your household free of typical noises such as pets, children, phones. Again, keep the online Zoom environment professional. Simulations planned for about 2.5 hours. For each sim. Our new debriefing process has added some time to the simulations, but the good news is we are able to count that time in our Typhon entries and it go toward direct patient care. So all case simulations are entered into the Typhon system. One reflective writing that we'll lead with that will be due at the end of week 1, and we're going to be looking specifically at the hypertension guidelines, and we're going to be looking at the levels of evidence and where those guidelines come from and what the levels of evidence mean. A copy of your work electronically and print that off because you're going to add this to your folder. All reflective writings, reflective topics you'll be looking back upon in preparation for the oral comprehensive exam this fall. Free SOAP notes this summer. You're going to be writing up the group interactive case simulation and the 2 individual sims. Use the acute and chronic SOAP note template to write up your SOAP note on. And remember, it's a template. And there's some prompters on there for you. So if the prompters are not necessary for the note, you want to remove any headers or prompters that aren't appropriate to be on the official SOAP note. Always take a look at the grading rubric in preparation for your SOAP note write-up. For any omissions or anything you need to add to your SOAP note that was not included in your case simulation, you can do that as you're processing that that patient encounter that occurred, and you can denote any omitted components or anything you feel like needed to be added that wasn't done during the sim. Include that in red text. If there's any SOAP note revisions that are required, then you're going to make those specific revisions in green text. Grades are placed within the Blackboard Learning Management System. I spoke earlier about late assignments and clinic attendance, as well as attending any scheduled Zoom sessions. This is a 16-week fall course, and the link to Colonel's Compass is here if you have any questions about dates or add drop. Just keep in mind that Zoom is like coming to the clinical setting and having an evaluation, so unauthorized visitors within those sessions are not permitted. Academic integrity is taken seriously here at EKU, and as you know, you have to mark that you have read, understand, and will abide by the academic integrity policy at the beginning of the course. I'll read this to you, however, I encourage you to read the social media policy and know what standards that you're held to and make sure that we're abiding by the social media policy. Everyone knows that we're going to be communicating via your official EKU email and not your personal email. Virtual office, that's a place to post questions related to the week that we're in within the course. For questions that you may have, and I'll respond to those just as promptly as possible. If you have anything that's more urgent, feel free to text or call me. If it's something that's more individual or personal, then I would send a direct email to me. I encourage you to always put an introduction into the class lounge and get to know your fellow classmates and soon to be fellow FNP colleagues. The Colonel's NP Corner, I hope you're very active in that this semester and putting any type of resources or clinical tools that we all might find helpful or that you have found out from your preceptor, any aha moments, any surprising or difficult cases. I know medicine is always changing, so if I come across any new apps or clinical guideline updates or anything I think might be very useful, I will also place that in the Colonel's NP Corner so that we can all take advantage of it. Technical support, our instructional designer is Sharon Bothan. If you have any issues with IT, you can contact her, and also the IT service help desk at 622-3000, area code 859. With a 100% online program, checking email regularly and responding promptly, as you guys know, is just critical. So I always try to respond to emails in a very timely manner. If I have not responded to you, I may not have received the email. Sometimes I wonder where emails go to email land. So I never worry about emailing me back again if I have not responded quickly. Again, if it's something that's more urgent, feel free to text or call me. Check that email at least daily for announcements and emails so that you're not missing anything, and respond in a timely manner so that we all can keep up with things. Currently, I do not anticipate any modifications to the syllabus. However, you all know we will continue to monitor the pandemic closely and notify you via announcement and email of any changes that might need to occur. If you're compliant with your organization's onboarding requirements, any requirements that your clinical site may have for you, whether that would be proof of immunization, CPR, background checks, drug screen, any kind of training. So just make sure you're compliant with any type of organization onboarding. Okay, I will not go through this in detail. You received the course outline earlier this semester, and there's not been any changes to the outline. I encourage you to get some type of electronic or desk calendar to become very organized in the beginning, along with your 800 course and your corresponding NSC 874 lecture course, and write down any type of due dates, Zoom sessions. Also utilize the form inside the 800 course under course documents. That form is the interactive meeting schedule. That will help you keep up with your Zoom sessions, links, courses, times, dates. Okay, let's take a look at the actual fall course. What you see when you log in, it brings you straight to the announcements page. Of course, there's not an announcement on here yet, but there will be when the course is available. There's the formal introduction, and then you are going to start here under the Start Here tab. Click on the Start Here tab, and here is what you will see. You will watch the formal introduction that is also located under that Introduction tab. Read the syllabus and watch this video and mark it complete. Take the quiz, syllabus quiz, receive 100%. You can take that quiz as many times as you need to. Read and mark the academic integrity policy and also the student clinical handbook. Once you complete all that, the preceptor materials packet will be available to you, and the first 2 weeks of the course will open. Let's take a look at the Forms tab. You can always come to the Forms tab and locate any form and submit forms. The preceptor material folder is here. The clinical placement waiver, which is new this semester, that is a waiver that you must complete prior to starting your clinical rotation. The clinical schedule form is located here. Daily clinical verification log. The clinical evaluation tool. The end of semester evaluation forms. And then this tab right here. You can always come over again. Remember, we clicked on that form tabs up above, and then scroll down to submit clinical forms and submit any forms through this link. They're also located throughout the appropriate weeks within the weekly lesson and assignments. But if you don't dig, always go back to the Forms tab, scroll down to submit clinical forms to make it easy if you're concerned about what week that might be in. Under Forms is the syllabus, and this is where the syllabus is going to be located. Faculty Info tab gives you information on the facilitators and myself, a little bio. Virtual Office tab, you guys are familiar with that. That is where you're going to see the class lounge, Colonel's NP corner, who to contact, Sharon Bother or EKUIT if you have any tech problems, and also our librarian, Karen Gilbert, and our virtual office by the week. I encourage you to click on these, and I have already subscribed to each week so that I will get an email notification if someone posts here, so I don't want to unsubscribe. But if you'll subscribe to each one of these, then you also will get an email notification when someone posts there. Do the same for any one of these links. If you want to subscribe to Class Lounge or subscribe to Colonel's NP Corner. I clicked on assignments. This is where all assignments within the course live, but as you all know, they're also located within the weekly lessons and assignments under the appropriate week for submission, but they can also easily be accessed under the assignments tab when you are ready to submit. I clicked on the weekly lessons and assignments tab, and this is just a reminder to go to the Start Here tab and complete all these items so that week 1 and week 2 will be available to you. And so, you have to click into each one of the weeks, and the assignments and the appropriate forms and drop boxes and everything will be located here for you under the appropriate week. I'll remind you about a couple of things over here to the side. You have up-to-date database access. Don't forget Collaborate rooms. There's Collaborate rooms that you can meet at any time with fellow students for a study session or to discuss case simulations. There's several rooms in there, and you can arrange to meet anytime, any day in one of the rooms. Just designate, what room and what time. Includes the syllabus review and a little bit overview of the Blackboard course. I am so excited about the skills and knowledge that you all have gained this summer. You have just, your level of confidence is increasing, and you've just made such great strides, and I can't wait to see that continue this fall. Let me know if you have any questions.